Hello everybody, I'm Ashok Sangal. Uh, I have been associated with Telemedicine Society for a very long time. It's almost 20 years I have been associated with telemedicine, and during last 10 years closely associated with the society which I indicated as vice president and president. Basically, I'm an engineer, communication engineer, and I have been associated with using the satellites because I was working in ISRO while traveling in the travel areas of region, Madhya Pradesh, travel region of Jabua. During one of the project review, I found the healthcare there to be very poor condition. The primary health center are not well equipped. Even I was shocked to learn that while the surgeries are performed on the travels without anesthesia, with the background music, folk music in the background, that is a state of affair. That led me to think as to how the space can be used for these societal applications. As such, I first started trials on using telemedicine for transfer of ECG from one place to another satellite, and that was successful. And subsequently, we had set up various networks in the country through ISRO. Health DNA, along with their event and media partner Mintlime, is promoting telehealth, a revolution in healthcare system as part of their monthly communication campaign. I'm here to contribute my part and will be speaking on telehealth, a journey forward for Ayushman. Priority of any government is to provide emphasis, is to provide healthcare to rural masses. India is predominantly a rural society. Majority of the people, so 70% of the Indians live in villages. The healthcare to most of them is a dream, a distant dream. Indian healthcare is organized in hierarchical uh, mode already, which is primary, secondary, and tertiary care. Primary care takes care of the requirement of healthcare in the villages. As on today, one primary healthcare center takes care of 30,000 people, and we have about 24,000, close to 24,000 primary health centers. If you multiply both, you will find out you are not able to take care of the vacancy of the healthcare requirement, even with these many of primary healthcare centers. So further, there is only one doctor in villages for, say, let's say about 5,000 population, as compared to the urban area where it is about one doctor for 1,500 people. But in the cities also, the the proportion is very skewed, like Chennai, a city which has about 4 doctors per 1,000 population. In overall country, we have about 1.5 doctors per 1,000, or let's say 3 doctors per 2,000 population. United Nations has laid down the criteria of universal healthcare availability, and that is one doctor for 1,000 people. Only 6 states in our country meet the UN criteria, and Overall, in the country, we have close to 10 lakh doctors, and we require still more, about 6 lakh doctors. Where do we get the 6 lakh doctor from? Our medical colleges are able to churn out only 10% of the doctors per year out of this. So it means it will take more than 15 to 20 years for to fill that gap. Further, the population will also grow. The doctors will also become, some of the doctors will also become old. So the problem is very complex. Further, the availability of super specialty in villages is not at all there. All the villagers have to rush to the cities in order to get the super specialty treatment on surgeries or neuro or all the other diseases. With this skewed medico-professional availability, telemedicine plays a vital role, where doctor can give virtual consultation to rural patients through local paramedic support. And that is the solution. That is, one doctor sitting in the hospital can take care of the villagers who are sitting in their villages or at primary health centers there. And the paramedic there could support consultation in discussion with the doctor at virtual and in the cities. And that way, without the doctor moving from city to village, which they are, they do not want to, oh, you can provide the health care to the needy in the villages. Several states also in the country have set up the network, large number of sub-centers with a super specialty node through satellites. Post-operative care is also taken care of by this virtual interaction. This way, the rural Indians are able to get the, rural Indians need not travel to cities for follow advice. Their first advice for first interaction can be in the cities in physical mode. Subsequently, for follow-up, they can be sitting at their places in villages, and they can have the virtual interaction. They do, in that process they don't lose their wages, because the villagers are mostly daily earners. Either they are daily earners on wages, manegra and other things, or they will be they will be busy in tilling the farms. They will be busy with their agriculture produce. The expenditure on logistics is also drastically reduced by this distant interaction, as the supporting people, along with the villagers, along with the patient, they rush to the cities. They do not get proper logistics support there. It's a tough job, and it's a burden to them as also on the cities. Several studies have indicated this mode of teleconsultation of great help to the needy. Sometimes back, about even decades back, I tell you, when the satellite connectivity was provided in the distant uh, islands like Andamans or Lakshadweep and so on and so forth, people were able to save the money to them, because the Lakshadweep region, they do not have the proper health care. They have to come to Cochin or South Kerala for ultimate treatment. This causes them tremendous amount of expenditure. This is saved if they are taken care of by this method. Satellite have connected the terrestrial, the villages or CSCs, or secondary healthcare center, to the super specialty centers in the states. Several states have got benefited by this method, and this is supporting the remote healthcare in the country. In fact, doctor sometimes, mostly it is felt that until unless physically doctor touches your body, you don't feel like you are getting proper treatment. But over the period, people have realized that that may not be important when it saves your time, when it saves your botheration, and so on and so forth. If you are able to get the proper diagnosis, then that may not be important. However, the first interaction could be physical. Physically, doctor can see you physically first time for your satisfaction, and then teleconsultation can take place. Several states like Odisha, Karnataka, Rajasthan, uh, and many other states are aggressively using it for the healthcare, for providing healthcare in the tribal regions. The first travel connectivity through satellite was in Karnataka, Chamaraja Hills, in the villages, and they got amply benefited. In the process, what had happened, the government also took initiative, and then the through Nayan Hridayalaya, number of ICUs were set up in Karnataka, tele ICUs at district level. Part of this was the doctors were serving there mostly free, and the connectivity funding was done by provided by state. Odisha also Odisha case was also very helpful, and in fact in Odisha people have to come to Lucknow or rush to Lucknow for all the treatment which has been avoided now. Similarly in Ladakh region also there is no healthcare. Satellite connectivity has helped them a lot. In during religious congregation like Kumbh and others, when there is no doctor, remote connectivity is very useful with super specialty. Disasters like tsunami, earthquake, and other disasters uh, have gained a lot by this remote telehealth care through satellites. Mobile vans have amply supported the periphery of the country for ophthalmic, diabetic treatment, and other healthcare modalities as first line of treatment. Such telemedicine initiatives have greatly benefited rural society, rural unreached, and saved a lot of revenue to government, has also saved precious life of the people. Coming to the paramedic training, in fact, villagers need to get the trained manpower in terms of supporting their mm, mm, paramedic staff, nurses, dies, how to deliver the child, and so on and so forth. Though they know how to deliver it, but how technically or scientifically they can be improved upon, rather the skill development that can be done by this network of telehealth care, where they can sit in panchayats in a group and then discuss the things. Already these types of things are being supported by various institutions like PGI Chandigarh, SGPGI Lucknow, Amrita Institute Cochin, SRMC Chennai, and various others. The terrestrial network like NKN, National Knowledge Network, is extensively supporting medical colleges network now with content server at NIC. This is being used to augment paramedic training, nurses, health records, and thus generating new avenues. Currently at panchayat level, telemedicine terrestrial CSC connectivity, the CSC is Common Services Center. These Common Services Center were set up by Government of India way back to support to provide the citizen to support citizens to provide common services to them, like certificate of land records, uh, birth certificate, death certificate, and so on and so forth. Now, these have been rather upgraded to support telemedicine with the support of uh, private enter hospitals under PPP mode, and the project is called Sehat, Social Endeavor for Health and Telemedicine. And instead of satellite, they are now connected on NOFN, National Optical Fiber Network, and about 240,000 CSCs will eventually be used for such application to cover the gap of non-availability of doctors and providing good telehealth care to the rural society. Corporates like Apollo, Medanta, and Global Health, they are already have already started providing these services to common service center under corporate social responsibility. Individual state initiatives like Karnataka, as I have told you, they have tele-ICU initially in district level. Now government has funding up to Talika level ICU, where remote uh, intensive care unit, number of remote intensive care unit could be remotely monitored at 146 taluka headquarters under local area development funds are being established in Karnataka. Also under government Arogya Abhiyan scheme 2335 2335 PSCs, which will be supported through CSC under the CSR responsibility. In fact, Karnataka is also supporting the startup, 12 startups in the state, which will use, which will develop the apps for the rural masses on their mobile uh, phones. The idea is that the villages are now connected on broadband, and each and every person that way has broadband and mobile, and because of low cost uh, mobile phones, now smartphones, you are able to add any application, and so the number of healthcare applications are already there, and some are getting developed which could be used for rural development. Similarly, in Uttar Pradesh, under National Rural Health Mission, 500 CSCs have been established with the support of a private party OTEC. In Andhra Pradesh, Tata Trust initiatives have set up telemedicine in 265 villages, and now in Maharashtra, 27 district hospitals under CSC uh, have been connected with telemedicine. Rajasthan is up in a part PPP mode. Medical college in Jaipur, one of the medical colleges in Jaipur, and is providing the medical support, and government has set up local uh, probed in local a private party to provide healthcare at various uh, districts hospitals and panchayat level, taluka level. Odisha also has wonderfully done. 30 districts are now connected in telemedicine, and with 3 medical colleges in the state. Further, oncology centers, 3 oncology centers and 11 tele-ICU have been set up by under Odisha Health Service Project. Northeast totally is supported by government for their ophthalmic needs. Number of startups, as I have told you, have initiated several apps. Hundreds of such mobile apps will eventually provide a much needed healthcare. Number of private entrepreneurs are coming up. Number of startups are being supported. Apps like click2click.com and davakhana.com are very popular now, where large number in Andhra Pradesh, especially large number of PSCs, CSCs, and district hospital are interconnected, providing teleconsultation and also providing the diagnostics report, testing laboratories quickly, thousands of such things, and they are extending their reach to some of the African countries as well. Under Digital India initiative of Prime Minister, Indian healthcare is providing solutions to non-invasive surgery, wearable devices, smart pill solutions, and so on and so forth, lead late ECG, and so on and so forth. Artificial intelligence based Alexa type of apps and many more uh, on the cloud will definitely make a good mark in providing the enhancing the healthcare in the villages. In fact, post-operative care and ICU is in ICU is a boon to the villages. Government plan to train Ayush, that is Ayurveda, Yoga, Unani, Siddhi, Homeopathy. Ayush trained doctors as a uh, uh, allopathic doctor after getting 2 years of training, so that they they can live in villages, and then because they are from villages they can live in villages. Our urban doctors do not want to move to villages. They can be trained to fill up the gap of healthcare services, and it also will support the rural heritage in the country, and other rural in the process other rural paramed can be trained for administrative and health record handling, etc., and doctor can be free. Ayush doctors can be free from this burden. They can get training for 2 to 3 years and become full-fledged doctor equivalent to MBBS. As such, there will be sea change soon with the launch of Ayush Bharat, and villagers will be amply benefited and crowding in cities can be reduced. Looking forward to a model India, and especially the model gram gram grams. Namaste, Jai Hind, thank you.